Welcome everyone to our weekly Q&A session with Toronto's Associate Medical Officer of Health, Dr. Vinita Dubey. Thank you so much for joining us again today.
Yeah, thanks for having me.
Absolutely. My name is Dilshad Burman. I'm a writer and reporter with City and 680 News, and I will be moderating this chat today. Now, if you have never seen one of these AMAs with the doctor, what we do is we collect questions over the week for the doctor. She's never seen them before. We present them to her today live, and she answers them off the cuff. If you haven't had a chance to submit your questions either on our website or through our social pages, you can still do so in this live chat during this broadcast, and we'll try to get to as many questions as we can in this short 30-minute period that we have with the doctor. So we're going to start off with the submitted questions, but feel free to jump in anytime and send us live questions and we will take them. Doctor, are you ready to go?
Yeah, let's go.
Okay, wonderful. So what we've been doing for the past few months is we've been starting with vaccine questions because they are top of mind for most people, and then we'll move on to the other questions. Let's start with vaccine questions. Now, Lorna asks, do you have to wait 3 months after having COVID to get your COVID shots, vaccine shots?
No, not at all. So actually, once you're out of isolation, you can actually get your COVID vaccine, and you can get your second vaccine on schedule. Sometimes if you've had a recent COVID infection, your symptoms can be a bit stronger after the vaccine. That's okay. That's normal. It actually means that you're probably going to get a better boost response as well from the vaccine.
Okay. And then Susan says, she has a two-part question. She says, I got my Pfizer vaccine second dose on the Saturday. She submitted this question on the Monday. Can I take a shower?
Absolutely. Yep. There's no contraindication for taking showers following your vaccinations.
Right. Yeah, that was a new one for me too. And then the second part of her question is, there are bumps on my armpits and a little bit of pain in my left hand. Is that normal after a vaccine?
It sure is. Yeah, the bumps in the armpit are actually your lymph nodes. It sounds like it. It's your swollen lymph glands. So when you get your vaccine in your arm, the lymph glands are actually part of your immune system. So it actually activates your immune system. So those lumps are the lymph nodes for your activated immune system. And then you can get pain in right where you had the vaccine, or it can go up or down your arm as well too, related to the vaccine. You could try putting ice on there. You could take over-the-counter medications if the pain is bad as well.
Okay. And then let's see, Jane asks, when I got my first dose of Pfizer, I had mild numbness, a tingly sensation, and sometimes little shocks, mostly on my left side where I got the shot. I went to the ER and they said that it was normal and it should go away in a week. It's been more than 2 months. It's definitely gotten better, but I still feel it sometimes. Is this normal? I haven't taken my second dose because I'm super nervous that it's going to get worse again. What would you do?
Okay, so I mean, I haven't fully examined you, so I can't fully describe what's going on. Sometimes when the needle goes in, it can irritate the nerve, and that can give you some of those symptoms. What I would suggest to you is, if you're worried about the one arm, get the vaccine on the other side. And that may help. You could also go to your doctor to get the vaccine. You know, if you were actually concerned about it, they could actually keep you in the clinic for half an hour after to make sure that you don't have symptoms as well. And then when you get your vaccine, maybe try putting some ice on it. It's actually, sometimes it can actually be the inflammation that also irritates, and that may help as well too.
Right. And then Simon asks, I believe I first experienced COVID symptoms a week ago around August 29th and have felt better each day after. The only drugs I took were Tylenol Ultra Relief to relieve headaches, once in the morning and once in the evening. Now I've stopped taking the Tylenol after September 3rd. When do you believe I should get my first vaccine shot? I'm a 24-year-old male.
Okay, so if you had symptoms of COVID on the 29th, I would still recommend that you go and get tested, even if your symptoms are getting better. It is always better to know if you really have COVID. If you have COVID, then we could do contact tracing. If you decide not to go for testing, then you actually really have to stay in self-isolation for 10 days from when your symptoms started. And so on day 11, you could then go out, do your regular activities if your symptoms are improved, and you could get your COVID vaccine then.
Okay. And then Cami has a two-part question. Cami says, I'm a retail store manager and need to hire more staff for Q4. Am I allowed to ask their vaccine status?
Okay, so good question. It's actually up to you to develop your own workplace vaccination policy. So you could have a policy for your employees. It could be that your employees are required to be vaccinated if you hire them, or to disclose vaccination status. We actually have information on our website, toronto.ca/COVID-19. There's actually a specific web page for workplaces, for employers, to help them to develop workplace vaccination policies.
Okay. And then part two of Cami's question, with Delta in mind, should fully vaxxed people be wearing masks while indoors with other friends or family members, especially thinking about Thanksgiving? Should there be limits to how many people gather over the holidays? Are infants and the elderly safe to be included in this group, even if they're fully vaccinated?
Yeah, another good question. Yes, definitely recommend that we continue with masking and physical distancing, having less gatherings, certainly less indoor gatherings. So in that situation, would recommend a small gathering. If the weather is good for Thanksgiving, actually take it outdoors.
Yeah.
If you're having it indoors, have less people wearing masks for sure. People who can't be vaccinated are obviously at a different risk, like infants. And people who are elderly, if they get a breakthrough case of COVID, are at a higher risk for having complications as well too. I think we have to keep a very close eye on our COVID case numbers. And, by Thanksgiving, there will be probably more specific guidance. But I think in the meanwhile, the science table has put out some recommendations and has said that we actually need to cut back on some of our activities. It's reduce our contacts. So those close contacts that we have with others, we need to start reducing those to prevent further spread.
Right. And let's see, we've got some live questions coming in here. So let's take these. I think these are from YouTube. League account says, how come the new MU variant has been found in almost every US state, but has not been mentioned in Canada yet?
Okay, so there are actually many other variants beyond the ones that we talk about. We know in Ontario, the Delta variant is predominant. More than 90% of cases have that variant. But there is what we call a surveillance system, a system in place to be able to check, a certain amount of samples to see if there are other variants spreading. We can expect that there are other variants around the world. It's really the variants of concern. And what that means is that the variant has been in one part of the world and is now in multiple countries. Maybe it spreads more easily. Maybe it causes more severe illness. And that variant of concern has now taken root and can become a dominant strain. And so it's those ones that we're really, really concerned about, really.
Yeah, absolutely. And then Candice asks, what interval between vaccine doses provides for the best long-term immunity?
Okay, so this is, again, a good question, and it's actually about a balancing act. Certainly, having some spacing between your doses, like 2 months or 3 months between your first and your second dose, will actually mean that your second dose will give you a stronger booster response. However, in waiting, say, 2 months before you get your second dose, you're actually more at risk of getting COVID right now, because we know with the Delta variant, you need those 2 doses. And so actually in the spring, when we had the delayed second dose strategy, because we had shortages of vaccine, we also had the Alpha variant that was spreading. And we knew with the Alpha variant, 1 dose actually gave us a very good protection. So it was actually a win-win at that time. At this time, because we have Delta, actually getting the 2 doses, at the shortest interval will give you the best protection against Delta. And that is actually really the immediate risk right now.
Right. Okay. Yeah. And like you said, it's a balancing act. Where do you want to risk COVID, or do you want to risk Delta, or do you want to get, your shots quicker? So that makes sense. And then, okay, let's take Danny's question coming in live. Recently, I've heard that the condition of long COVID problem comes after vaccination. Do you have any knowledge about this?
Okay, so I'm not aware of cases of long COVID linked to vaccination. What's not clear is if you are vaccinated and you get COVID, can you get long COVID after that?
Mhm.
That part, I'm not clear on an answer for that, and I think there's more data that we need to collect on that. But if you are vaccinated and you prevent COVID, you're also preventing long COVID.
Right, absolutely. And when it comes to, doctor, the sort of symptoms or side effects that you have after the vaccination, could those last for a long time as well? I feel like some people are conflating those two things, that it's side effects after the vaccine, whereas getting COVID is a whole other thing.
Yeah, that's a really good point. I mean, we expect that you can have symptoms after the vaccine. Most of the symptoms last 3 to 4 days. And some people, they can last a bit longer, but they tend not to last for months, similar to long COVID. I think the other point to note is it takes time for you to develop your immunity, at least 2 weeks. And we know in that first month after your first dose, you can still get COVID. And so that may also be contributing to why people say they got long COVID, even if they were vaccinated. It may just have been after their first dose as well, where they actually got COVID.
Right, okay. And let's go back to our submitted questions. Toronto Mom asks, I've read a few articles related to spacing the second vaccine shot to increase antibodies. My 12-year-old now has passed the 3-week mark for getting her second dose. Is it better for her to wait for 8 weeks to get her second dose to maximize antibodies, or go sooner like we just talked about?
Yeah, at this stage, you know, your 12-year-old is heading back to school, maybe is already back at school, and that and we've started the fourth wave. And we know that the fourth wave is predominantly the Delta variant. And so I would recommend getting that second dose if possible. It still does take 2 weeks after the second dose to have that best protection from when the second dose is given as well.
Right. Sorry, doctor, just to clarify, because we lost your voice. So you would recommend to take it as soon as possible?
Yes, because we're in the fourth wave, because your child is probably back at school or going back to school, and because it's the Delta variant that's spreading right now, and we need that second dose really for that protection.
Right, got it. Okay. And then, oh, this is an interesting one. Kuldeep asks, both me and my wife got fully vaccinated by COVID in India. How do we get our vaccination passport in Canada now that we've landed here?
Okay, so what you need to do is to connect with your local public health unit. If you live in Toronto, that could be Toronto Public Health. And we actually have a survey online through our website, and you can complete it with the information for your vaccine that you got abroad. And we can then put it into the system. The system in Ontario is called COVAX, so that you have your vaccinations recorded in that system.
Right, okay. And then let's move on to Nikki's question, again about Covishield, but slightly different. Those of us who received a mix of Covishield AstraZeneca are finding it increasingly difficult to make any future plans that involve travel outside of Canada. As we took the original government advice, do you think it is possible that eventually we'll be permitted to be revaccinated with an mRNA vaccine, or at least be given an mRNA booster? The mixed vaccine issues are not going away anytime soon.
Yeah, I understand that. I mean, things are constantly changing, and it's, you know, we've talked about this. It's hard to control policies in other countries.
Yes.
The issue about booster doses is certainly of active discussion around the world. We've seen some countries say that, you know, in Israel, you're eligible. In the US, they're just waiting for authorization, and then they will be starting booster doses. Mm-hmm. And in Canada, we're certainly looking at this question of booster doses. We've talked before about how in Ontario, very select small groups are going ahead with booster doses right now. But if it's recommended more broadly, then yes, that recommendation will be made, including if it's only recommended, say, if you got AstraZeneca or whatever. That is something that we are certainly looking at. Right,
right. So it's possible that booster doses might be expanded, but perhaps only to the people that got AstraZeneca.
Yeah, I wouldn't go so far to say as maybe just for them. I mean, it's something that we're going to look at. Maybe it's just based on age. Maybe it's based on time since you last had your vaccine dose. Maybe if you got a breakthrough, you know, like there are a lot of things to think about in terms of who might benefit from a booster dose and who it would be recommended for.
Right, right, absolutely. Okay, we've got a live question coming in here from Unix. When will Novavax be available in Canada, and is it better than Pfizer or Moderna?
Okay, Novavax is what we call a protein subunit vaccine. It's very similar to the type of vaccines that we have for the flu. Instead of getting your body to make a protein and then to develop antibodies against it, you actually have the protein and then you develop antibodies against it. Novavax has to file for submission and licensure in Canada before it can actually be approved and before we can even hope to have it. So I think that is the next step. We have seen, though, I mean, the Johnson & Johnson vaccine has been approved in Canada since the spring, but we actually haven't had supply of it. So I think that's probably also what manufacturers are trying to balance, like to go for licensure, but also they probably want to make sure that if it's licensed, they have some vaccine that they could send to the country where it is licensed.
Right, absolutely. Okay, let's go back to our submitted questions. Curious asks, my husband and I are seniors and fully vaccinated. Some of our children, as well as their spouses, are not vaccinated. Should we be around them or take any precautions?
Well, I might recommend that you try as best you can to talk to them, listen to them about why they choose not to be vaccinated. I mean, I think certainly getting your family, your friends, people who you spend a lot of time with vaccinated is still the best way to protect you, especially if you're elderly and are at higher risk. And I think that there's no question that unvaccinated people have a higher risk of getting COVID, 7 times more likely to get COVID. If they get COVID, you know, many, many times more likely to be hospitalized. And so that's definitely something that I think that you would want to consider. I think if you want to meet up with your family, take it outdoors, still wear that mask and still keep that physical distance.
Right, absolutely. Okay, let's keep moving. Lisa asks, if there's no study on pregnant women, why are some obstetricians recommending the vaccine?
So the vaccines have actually, it's called post-marketing studies. So there have been registries where people who were pregnant were vaccinated and then followed along in their pregnancy, and that has been recorded. And so those studies, those post-marketing studies are available in pregnancy and have so far continued to show, first of all, that the vaccines work in pregnancy. We know that we need vaccines in pregnancy because in pregnancy you can get very, very sick. But they've also shown that there's no increased risk to the baby or to the mother when you get the vaccine in pregnancy.
Okay. So there have been essentially studies, even though they're like you said, post-market studies, right?
That's right. Yep.
Okay. And then Elvi asks, we just talked about Johnson & Johnson. Why is the 1-dose Johnson & Johnson vaccine not available in Canada yet?
Yeah, I'm not exactly sure on the specifics, but you know, it is not available here yet, and so that's just the reality of it. It's not that, you know, it's here and we're not using it. It's actually is not here. Yeah.
Right. Okay, and that's the end of our vaccine questions for now. But if you still have more vaccine questions, please feel free to submit. We're going to move on to some non-vaccine related questions now. Lots of school and gathering questions this week. So Leslie asks, my son will head back to school tomorrow. How can he protect himself when he has lunch inside the class with the rest of the kids?
Okay, so good luck to your son, Leslie, going back to school. Toronto Public Health has provided guidance to our Toronto schools on how to have lunch safer. Essentially, we recognize that when you take that mask off in a classroom setting, that is probably one of our higher risk settings in the school this year. And so we have recommended that when masks are removed for eating, for example, that 6 feet physical distance between students is maintained. And to have quiet lunches, for example, to not move around for lunch. And so this might mean in a classroom, if there are many students, that every other person eats, you know, with them and then take, you know, alternate to be able to keep that physical distance as well.
Right. And then let's talk about the Delta variant. Jeff asks, are they testing every sample for which variant it is? Because the hospital that they went to said, no, they don't test for it as it takes too long.
So my understanding is that it's now a surveillance program, and there's a select percentage of samples that are going for some of this testing. So every sample is getting some tests. Not every sample is getting the full test to see exactly which variant it is, but there are tests. And based on, positive for this gene, negative for that gene, you can determine whether it's likely to be Delta or not.
Okay. And then a couple of live questions again. Robert asks, why are they allowing unvaccinated kids to go to school?
Well, we do know that while vaccines are our best protection, there are other ways to offer protection. And, around the world, schools have reopened, and there certainly has been, scientific evidence that, wearing that mask, staying in a cohort, staying home if you're sick, all of those measures can actually work in a school setting, even among unvaccinated students. And so I think that's the answer. Why can unvaccinated students still attend school safely? It's because of all of those other measures that will be in place.
Right. And a couple more live questions. Danny asks, what would you say to people who are listening to various, podcasts and things like that and are thinking of taking ivermectin to mitigate COVID?
There certainly is no evidence for that. Ivermectin is a good drug for what it is intended for. Continues to be no evidence that it works to prevent COVID or to treat COVID effectively. If you want to prevent COVID, actually the thing that has been shown to work very well are vaccines.
Right.
And so I would say for someone who wants to prevent COVID, get the vaccine rather than trying ivermectin, which certainly has not been proven to be a preventative measure.
Right. And self-medication in general, I think, is probably not necessarily advised for anything, really, I would say. So if this is not a proven drug that we've talked about this several times, that ivermectin is not effective against COVID, then perhaps don't do that. It's just my 2 cents there. Okay, let's go on to Wing's question. Wing submits regularly. According to the CMA and OMA, there are rare medical exemptions for the COVID-19 vaccine. So why are the COVID-19 tests for the anti-vaccinated people being publicly funded? The consequences is that they occupy critical hospital space, and vaccines are the easiest to implement with low cost, unlike, say, an HVAC system. So why are the COVID-19 tests publicly funded?
Yeah, I think these are all really good questions. And I think really we're in a system where there is choice, and there is choice to be vaccinated. And if you're not vaccinated, there are sometimes alternative paths like testing, or maybe in the future it means you can't go to a sporting event or into a movie theater, for example. We are in a publicly funded healthcare system, and we do not I work in healthcare. I don't say, well, you smoke, so I'm not going to treat you for your lung cancer. That is not the approach that we take in healthcare.
Right.
We do really truly treat every patient with the same compassion and kindness, regardless of their circumstance. So that is the approach that we take as healthcare providers as well.
Right, absolutely. And like you said, there's choice. I don't think, people need to be punished for that choice. If you're sick, you're sick. If you need a test, you need a test, right? So.
And I think the approach that we take in healthcare is try to, make you realize before you get very sick. Mm-hmm. It's not always successful. We have, as a community, as a society, done very well with vaccination rates. And I think this is where we can all kind of step in to talk to people who are not vaccinated to help them to make that choice and that decision.
For sure. Okay, let's go to some more submitted questions. Paige asks, is the Delta variant milder in children? Is there any data on hospitalization for kids with Delta or deaths of kids with Delta?
Okay, so this is something that's certainly being followed. There certainly have been hospitalizations even in Canada related to COVID, and they are going up as case numbers are going up. We've seen in places like the US where there certainly have been more hospitalizations, more severe illness in children, but their case rates are also up. So It seems to be that it's because you have a lot of COVID in children, a proportion of those are going to get very sick. It's what's not clear, and I think the answer right now is no, that the Delta variant is not more severe in children, but this is something that we have to really keep a close eye on as we enter the fall season as well.
Is it as bad in children, doctor, or are they getting milder cases even though it's Delta?
Yeah, typically for COVID-19, it tends to be milder in children. But as I said, there have been hospitalizations even in Ontario among children for COVID right now.
Right, absolutely. And let's take Farah's question. She's also concerned about school. How safe are our school? How safe will the schools be? Because most kids in elementary school are under 12 and they don't have their vaccine yet. It's very concerning for parents to decide what to do, as the schools are not really giving any specific information on how they're going to maintain that physical distance or whether their ventilation systems are up to date. They also can't leave the windows open in the winter. So how safe is it really for elementary kids?
Yeah, so I mean, there are many layers in place in elementary schools. I can certainly tell you that Toronto Public Health has provided guidance to schools, so you can certainly look up our guidance. We've actually updated our guidance today to also ask schools and school boards to pause extracurricular activities, field trips, high contact sports between cohorts. Let's see how the start of school goes. Let's make sure that cases don't accelerate in September. So we will continue as a public health unit to update our guidance as well to keep schools as safe as can be.
Right. And this is an interesting one. It came up a lot in the beginning of the pandemic. Let's ask this one. Steve asks, what are the numbers of COVID cases in relation to blood type? Is there any correlation with certain types of blood types and getting COVID?
No, I have not seen any data to suggest that this blood type maybe make you more likely to get COVID or to get severely sick from COVID. We know that a COVID infection is caused by a virus. We know it's usually the spike protein that invades and starts the infection anyways. And so it's hard to understand scientifically how a blood type might make you more or less protected.
Right, and consequently, we don't have numbers based on blood type available as such.
Right, yeah.
Right. Okay, okay, Cassia asks, what happened to the good old flu? Where did it go this year?
Right, so this past year, the good old flu, I think, was blocked, actually prevented because of all of our measures that were in place. It's amazing to see what staying at home, keeping a distance, wearing a mask, all of those things actually were helpful to help prevent the flu. This fall, we are more mobile than we were last year, and the flu we anticipate can certainly spread as well as other viruses this year. And so that's, even more of a reason why we're going to need to continue with some of those other public health measures, because it's actually not just COVID, it's actually all of those other viruses that we can get that can also put a heavy strain on our healthcare system as well.
Right. Couple of live questions coming in. Let's take this. Mike asks, based on the Israeli experience, the vaccine does not stop the infection, it only reduces the severity. Why is Ontario moving towards a vaccine passport if vaccination makes no difference to infection?
Well, right now, the goals of our vaccine program are to actually prevent the severe illnesses. So that is actually really important because that is what helps to protect our healthcare system. It keeps people from getting very sick from COVID. And so I think that that's the important point, that we do need to keep in mind that the vaccines are working because of that. Now, if we want vaccines to prevent infection, maybe we need more doses. Maybe we need to do more to prevent infection then, which might include things like no more gatherings, no more indoor gatherings, right? We know what it takes to prevent the spread of COVID. And so I think that really the goal of the vaccination program right now is to prevent the severe illness.
Right, and overwhelming the hospital system, which has sort of been the goal all along. I think even when we were talking about the first and second waves, the idea is to protect the hospital system so that it doesn't entirely collapse under the load of all of the cases, right?
That's right. And to put it into a more personal context, it means that when one of our loved ones has a heart attack, there's space in the hospital to treat that. Or if they get a new cancer diagnosis, that can be dealt with, that, elective surgeries are not being canceled, for example.
Yeah, exactly. And we saw a lot of that. We saw a lot of surgery backlog in Ontario as well, because the hospital system was overwhelmed. So that makes sense, of course. Let's move on to Lena's question. Lena asks, how come Alberta is opening up completely? What are they doing that Ontario is not doing that has allowed them to open up to such a degree?
Well, I think Alberta has made decisions on how they want to address COVID. There's no question that opening up for them has meant more infections. I mean, that is the path that they have taken.
Right. Right, absolutely. Sorry, so that brings us to 1 o'clock. I was just looking at the time. Doctor, thank you so much for joining us and answering all of these questions. Thank you to everybody that participated live. If we didn't get to your question, we will try to get to it next week because we'll be back. So thank you, Doctor. We'll sign off for now.
Bye.